Hello everyone, today let's discuss on important one-liners from growth, which is very important for your TNMRB 2026 and also for your NEET PG 2026. Why? Because these are all your very basic topics, right? Yes, if the child is less than 2 years, we measure what it is called as length, okay? And if the child is more than 2 years of age, you measure it as height. Your length is measured in infantometer. This picture or this diagram here is your infantometer. This one here is your stadiometer. You measure height of the child if the child is more than 2 years of age in a stadiometer. Less than 2 years, it is called as length. You measure it in infantometer. So average length of the child at birth is 50 centimeter. Okay. At 1 year, it will be around 75 centimeter. So there is an increase of around 25 centimeter. And at 2 years, the average height of the child will be 87.5 centimeter. So there is an increase of around 12.5 centimeter. Okay. So this maximum growth or maximum growth occurs at 1 year of age. Maximum growth occurs at 1 year of age, right? Why? Because there is an increase of 25 centimeter at first year, while from first year to 2 years of age there will be an increase of 12.5 centimeter, that is half of your 25 centimeter, right? Next, how do you calculate height of the child between 2 to 12 years of age? By using your formula. So expected height is calculated by using the formula. You know, everybody knows it's your Weeds formula. It is 6x plus 77 is your Weeds formula, where your x stands for the age of the child. So x stands for age of the child in years, right? Okay. When does the height of the child doubles? Height of the child doubles by 4 years of age. Apo, what will be the height of the child you have to expect at 4 years? It is 100 centimeter. Okay. So doubles by 4. Height of the child will double by 4 years of age. Maximum for 4 years. Maximum height will occur at first year of life. This is regarding your length and height. Next is regarding your weight. When does your weight doubles? Your weight will double by, everybody knows, at 5 months. Triple by around 1 year and quadruples by around 2 years of age. And to know your expected or to calculate the expected weight of the child, we are using your Weeds formula. At 3 to 12 months, it is age in months plus 9 by 2. It is your formula. And for the child between 1 to 6 years of age, we use 2x plus 8, where this x stands for age of the child in years. Next, if the child is between 7 to 12 years of age, then it is 7x minus 5 divided by 2, where your x here also stands for age of the child in years. So this is the formula we use to calculate the expected weight of the child, right? This is using your Weeds formula. Next, this is regarding small or main one mark or one liners regarding the weight. Next is regarding the head circumference. So it's nothing but your occipitofrontal circumference. So average head circumference of the child at birth will be around 33 to 35 centimeter. In first 3 months, there will be an increase of centimeter per month. By 3 to 6 months, there will be an increase of 1 centimeter per month. From 6 months to 1 will be an increase of 0.5 centimeter per month. So by maximum head circumference or maximum growth of the head will happen between first year till, from birth till 2 years of age. Adlume maximum will be around first 3 months of age. So by the end of your 3rd month, you can expect the child's head circumference to be 39 centimeter. If you calculate by using a 33 centimeter average head circumference, you take as 33 centimeter and then you calculate it as 2 centimeter per month, then you can expect the child's head circumference to be 39 centimeter per month. Okay, this is regarding your head circumference. Next, a very important growth curve. Here we are having age in x-axis. I have taken in x-axis age in years. And in y-axis, it is your size attained in percentage regarding your postnatal growth. First one, A. First curve is your somatic growth. It indicates your somatic growth, which is a sigmoid curve. The maximum growth will occur at first 2 years of age, and then it will come to a stagnant phase or a horizontal phase, and after that again a growth spurt will occur around 11 years to 12 years of age. Then you will have a growth spurt, right? So this is regarding your somatic growth. This growth, sigmoid shaped growth curve is your somatic growth. Next one is your B. This is your B, this blue color one. This blue color line indicates your neural growth or your brain growth. So the maximum growth occurs till your 2 years to 3 years of age. The maximum head circumference will happen at first 2 years of age. Then it will again go into a neutral phase. So that is your neural curve or your brain growth. Next, C1. That is your violet color curve. This violet color curve is nothing but it indicates your lymphoid growth. The maximum growth or maximum peak phase of your lymphoid growth will be between 8 to 12 to 14 years of age. Between 8 to 14 years of age will be your maximum lymphoid growth will occur. Next, this red color curve. This red color curve represents your genital growth, where it will be in a very small phase at till 11 years of age, and after 11 years there will be an increased growth spurt of your genital organs. So this D represents genital growth. So why this curve is more important is they can give you this graph and they can mark it as A, B, C and D, and they can tell to match. They can give options as A, this one, B neural growth, C somatic growth. They can tell you to match the correct options from this curve. So this is very, very important. So A is your somatic growth, B will be your neural growth, C is your lymphoid, and D will be your genital curve. Okay. Next is regarding your severe acute malnutrition. So what is the criteria of the child to tell that the child is having a severe acute malnutrition? So this criteria is being used if the child is between 6 months to 59 months of age. That is 6 months to 5 years of age. That is when the weight for it is less than -3 standard deviation. Mid upper arm circumference is less than 11.5 centimeter, and this child is having bilateral pedal edema, symmetrical pedal edema. Okay, bilateral symmetrical edema. Next, when this child is having visible severe wasting. So if any one of this following is being present, then you call the child to have a severe acute malnourishment. Okay, ma? Yes, if any one, that is if the weight for it is less than -3 standard deviation, or mid upper arm circumference is less than 11.5 centimeter, or if the child is having bilateral symmetrical pedal edema, and or if there is a visible wasting. Supposing if the child is less than 6 months of age, you cannot use this